Hello, my name's Craig Dalton. I'm a public health physician and conjoint associate professor at the University of Newcastle. I've been investigating outbreaks for about 30 years now, and I want to talk to you about coronavirus or COVID-19. On the 5th of March, I published this paper, some easy, low-cost interventions we could put into place in the community and workplaces and schools to decrease the transmission of COVID-19. It gained a lot of attention, surprisingly, in the US.
All of this information came from a paper that Dr. Fauci provided from the Australians, first author Dalton, so you can actually look up the scientific evidence that informed each of these guidelines.
When I published this paper on the 5th of March, there were only 57 cases of COVID-19 in Australia. Now, on the 16th of March, there are 336 cases of COVID-19. If we look at this graph, we can see that from the 10th of March through to the 16th of March, we've gone from 106 to 336 cases. If you look closely at these numbers, you can see that it's taken about 4 days on average to double. You can see that from the 10th of March to the 14th of March, it's almost doubled. And then from the 11th of March to the 15th of March, we've gone from 122 to 279, so that's more than doubling. From the 12th of March through to the 16th of March, we have more than doubled. In fact, we've really met the doubling at the 3-day mark. And from 189 through to 336, we're going to have doubled by tomorrow, making it again 4 days to double the count of cases. So there's a 4-day doubling time. Every 4 days, the number of cases doubles. This leads to an exponential growth. And often exponential growth creeps up on us before we realize it, and we get surprised when the numbers get really big. So let's look at what a doubling time of 4 days does to the numbers in Australia if we project out from the 20th of March right through to April. So on the 16th of March we had 336 cases, which means that if we double over 4 days to the 20th of March we have 672. We double again to the 24th of March, 1,344, 2,688 on the 28th of March, and so on. And you can see that every 4 days we get this doubling until in April we're at 43,000 cases. So when I show people this graph, they're usually shocked. In fact, my son just said, "Holy shit, Dad." And it's because we're not used to thinking exponentially. We usually think linearly, but epidemics are exponential, and this is what happens. And this is why Italy got surprised. They didn't think it would happen like this. This is why, well, China didn't get so surprised. They did think it would happen like this, and that's why they intervened so hard. So let's look at where Italy is now. They're around about 24,000 cases on the 16th of March. Now, Italy went from our case count of around 300 to 24,000 in 19 days. Around 27th of February, they were where we are now. And then in 19 days, they got up to 24,000. Now, interestingly, if we look at where we are now and then we project forward to the 9th of April, that is 23 days. So you can see at the moment, we're on about the same trajectory as Italy. So what do these numbers actually mean? Well, if we look out to early April, somewhere between the 10,000 and 21,000 cases, that's where we're using about half of all the ICU beds in Australia, just for coronavirus patients. And most ICU beds in Australia are full most of the time, so it's going to be very hard to use half of them for coronavirus only. And beyond that, if we continue at this rate and then double every 4 days, we're going to be trying to use all of Australian ICU beds for coronavirus patients, and we're going to be trying to expand them to accommodate them. Now, it may not be till mid-April to late April because there's a little bit of delay between the time the cases have onset and they need ICU. But it is around about that time based on these projections, unless we do something very different and very decisive. So here's why we have to be very decisive and why so many countries get surprised. They put in all sorts of interventions which they think are going to be effective. Sometimes they think they're even draconian interventions, and then it's not enough and they have to go harder and harder again. So this is the problem. Not only is this exponential growth, which is counterintuitive for a lot of people, but there's a delay in the reporting. We've got a 4-day doubling time, plus we have an 8-day delay between the onset of illness in a case and the time that a public health agency usually gets the report. So all these graphs I'm showing you here are the day of the receipt of the report. But their illness is on average 8 days earlier. And as you know, 8 days is equal to 2 lots of 4-day doubling times. So that means even though we have 336 cases reported on the 16th of March, that's actually looking back 8 days to onset. So this is like driving along the road looking in the rear view mirror unless you make that adjustment, unless you realise that you're looking back at history. So at the moment, if we have 336 reported cases, we actually jump forward to the number that you can see for 24th of March, and that's our probable number, about 1,300 cases that will be reported by that time. But of course there's more than that because we're actually missing some cases, even though Australia has very good surveillance and much better surveillance than most other countries, perhaps apart from Singapore. We would be missing some, so it'll be even greater than that. And we know that we have better surveillance than Italy. For one thing, we're doing a lot more testing a lot early and looking for cases a lot harder. And when they had as many cases as we do now, they had more than double the deaths. And that's a really good way of telling how sensitive your surveillance system is. So Australia was really looking much better than Italy was in terms of doing surveillance for cases and milder cases rather than just the most severe cases. So that's an incredible advantage we have over Italy. And we don't have to go down the path of Italy. We have a lot of options. If you look at this graph here, you can see the benefit of acting early. The blue line is what actually happened in Wuhan, and the lines that follow it show what happened if they'd acted 1 week, 2 weeks, and 3 weeks later. And you can see that a delay of 1 week almost doubles the number of cases they would have had in Wuhan, and by leaving it 3 weeks late, you end up with over 90,000 extra cases that were prevented by the early interventions there. So you can see the importance of going as early as possible. And it's actually hard to go too early. You'll often see maybe your neighbours, maybe agencies saying we have to have a proportionate response and not respond too early. It's actually really hard to respond too early because of the exponential nature of these outbreaks. And you'll see time and again, a country will go through tiered approaches, trying to be proportionate, but as each increasing level of intervention is laid upon the prior level, they find they're running late, finding they're running late behind the outbreak. So if we're going to go for proportionate responses, we need to say, what are the triggers for each level of intervention? If we can articulate them now, if we can say at this many cases we'll do this, at this level of community transmission we'll do this, if there's a clear plan, that's fine, we can trust in that. But if there's not a clear plan that triggers each tiered intervention, we probably should go as early as possible and as hard as possible. And if we do this, we can flatten the curve so that this huge area in the orange curve here, all this unmet need that overwhelms health service capacity doesn't happen. So we can smooth out the outbreak over a longer period of time and more people can get the care they need. This is going to be particularly hard on older people, on people with underlying immune conditions, and it's going to be really, really tough on the doctors and the nurses and the physiotherapists and the cleaners, anyone working in a hospital who's going to have to cope with a hospital system that is just buckling under the onslaught of too many cases. And so we owe it not just to the healthcare system, to the folks who go and really going to work hard under incredible conditions, but to everybody. And it's not just a question of the risk being low for any one individual. We have to think of the whole of society. Sure, the risk is low for any one person. Only about 5% of people in Wuhan actually contracted coronavirus, but you saw the terrible impact that had. So we need to think about ourselves as a community, and that we have to collectively collaborate to decrease the transmission of this virus. We need everybody to make some really big changes, and this is probably in the next week if we're going to get off the trajectory that Italy followed. So we need a whole of government, business and civil society mobilisation. And we can't rely on government bans on mass gatherings alone. Every one of us needs to begin looking at significant social distancing, and we need to do it very soon. So that means even closing down small gatherings of 10 or 20 or 5 people, really only attending, really going to really stopping the non-essential gatherings, replacing meetings with teleconference, video conference, massively enhancing our hand washing, hand sanitisation, really protecting folks over 65 years of age, people with chronic disease, and really making sure that if we're ill, we don't go to the workplace, we don't go visit people. Any coughs and colds need to be excluded from the workplace. And for folks who are returned travellers or contacts of cases, really to stay in isolation until they're released and not infectious anymore. And it's only a massive change across all of society that will be able to turn the trajectory of this virus in Australia around. Okay, thank you for listening.